Pregnancy Awareness Week takes place in February each year and is a way to strengthen pregnancy education and stress important issues that promote a healthy pregnancy and safe motherhood. To talk more on this, we are joined by Dr Manala Makua, who is the Chief Director of Women's Maternal and Reproductive Health at the National Department of Health. Dr Makua, thank you so very much for availing yourself here to SABC News, ma'am.
Thank you, and thank you for having me, and good afternoon to all the viewers at home.
Let's start by talking about the importance of Pregnancy Awareness Week. Why have a week to observe pregnancy? And is this Awareness Week really observed by the general public of South Africa? I must say, I've rarely heard people talking about observing Pregnancy Awareness Week.
Yes, the Pregnancy Awareness Week is focusing at encouraging women, potential mothers, to enjoy the journey of becoming mothers. So we're just raising awareness that if you do the right things the right way, you are likely to have better outcomes.
Doctor, are all pregnant women aware of their rights and what they can access from the Department of Health? You know, you sometimes hear some frightening stories about, pregnant women who, particularly those going to government institutions, government hospitals, and I wonder if they're aware of the rights that they have.
We are doing as much as we can from the department to make sure that we raise awareness. For an example, if you would remember the project that is launched some time ago, around 2014, on Mom Connect, the sole purpose of that project was to educate the mothers about their rights and what they should expect when they get to the health facilities, and how should they communicate, and what should they do if they're not being communicated to, and also to give us feedback as a department on the type of service that they are receiving within the facility.
Is there enough being done, Doctor, to educate a woman that are pregnant? Let's just say, for example, things like the main danger signs during pregnancies. I mean, you'll hear a lot of about miscarriages, for example. You will hear about women perhaps dying while giving birth. I mean, some of these scary situations around pregnancy. Is there enough being done by the department to educate women that are pregnant, and where do they access that kind of information?
The one critical thing that we are doing as a department is we're encouraging all pregnant mothers to visit their nearest clinic as early as possible when they discover pregnancy. The reason for doing that is the book that they are giving them when they report at the antenatal clinic. It's got a lot of information. It's got many pages of information. For an example, it will show you how to count your kicks, if the baby is starting to move in your tummy. It will show you the early signs of feeling a pressure or the psychological pressure in your body, your mental status. It will show you all the other information that you would need and what to report in case of an emergency, especially relating it to the issues of stillbirth. Because most women end up with stillbirth or intrauterine death, meaning the baby dying while in utero, which is the most traumatic thing, because they did not realize that the baby has stopped moving while the baby was supposed to be moving. So that booklet got a lot of information. So as a basic information, you'll get it from there. That's why we're saying mothers should not leave that book at the clinic. They must take it along, carry it along, read from one page to the last page of it. It's got a lot of information. Yeah. But over and above, we have the Mom Connect that is now talking in a simpler terms of what to expect during the journey of pregnancy.
Yeah, and then in terms of healthcare workers who deal with pregnant women, for instance, nurses who deal in government institutions with pregnant women, is there enough education for them and continuous education in terms of how these women should be treated when new things come up? For example, now we're dealing with COVID-19, and now that makes the issue of pregnancy even more difficult, because you've also got to worry about not contracting the virus. Is there continuous sort of education, training of those dealing with pregnant women? I'm speaking specifically about, healthcare workers, let's say nurses.
Yes, healthcare workers, nurses are just part of them, but you would realize that in the healthcare services, we've got more than nurses and all other categories. So the information, yes, the companion system that we have to support patients on Mom Connect, we have what we call a Nurse Connect. So that is a platform that assists healthcare providers in providing them with continuous, relevant information and up-to-date new developments in terms of what should they do in terms of complicated pregnancies and how should they handle that. But over and above, you have touched on an important issue on the care in terms of respect between the mothers and healthcare workers. So in several facilities across the country, we've launched what we call a respectful maternal care package. Mainly what we are doing there is to assist the healthcare workers to manage the complex, urgent, complicated situations that involve delivery in the most respectful manner and do not in any form disrespect women.
All right. Dr. Manala Makua, we appreciate your time. Thank you very much for speaking to us as we observe Pregnancy Awareness Week. Many thanks to you.
My pleasure. And thank